Yes, our Dr. Arvind Kumar MORYA, an energetic young professor, to talk on the AI. And the whole session is conceived by him.
Good morning, everyone, and thank you, sir, for your kind introduction. I would like to thank Professor Dr. Modini Pandarkar for giving me the opportunity. She was not able to make it today. So my talk is on smartphone-based applications which can be used and which are used in ophthalmology. So these mobile-based technology, definitely they are the future of telemedicine, and they help in the outreach activities which are centered around the home only, and especially the visual acuity and the visual field screening applications are there, which are capable of detecting visual degradation even before they present to a healthcare professional. And the patient feel more engaged and improve their compliance. And these smartphone applications are capable of improving the disease outcomes. So right now there are more than 700 applications with eye care themed, in which 259 applications are of some or the other use for the general healthcare, and 131 applications are relevant exclusively for the ophthalmic practice. Regarding the cost effectiveness, 76% of the applications are available for free, and about 22% need a monthly or annual payment. And in about 2% of the applications, the developers have provided a free trial of about 2 weeks. So these are the distribution of application as per utility and operating system. So the topping in the chart is the vision screening, then the eye exercise, professional education, etc. Regarding the reviewer rating and validation, so 13 applications had more than 500 reviewers, all designed for the non-eye care professionals, including the eye test application, designed for general public largest number of reviewers rating. And the application with maximum reviewer rating is Smart Optometry app with 50,000 downloads and 680 reviewers. Regarding the validation, that is a very important aspect, but unfortunately, only 4 apps are claimed by the developers to have undergone some validation test. And 3 applications were designed by the eye care professionals without any involvement of the developer. And 10 applications were endorsed by the eye care professionals and the healthcare institutions. My Vision Tracker MVT is the first ophthalmic application which has been US FDA approved in 2014. So we look at the mind map of the smartphone application. So it is not limited to the ophthalmic education. There are a lot of applications which are there for the patient education. Then there are calculators. Then there are low visual assistance and of course vision screening. So these are the important applications. So first is the Peak Acuity app. This is a highly validated application. It is developed by the International Center for Eye Health, Department of Clinical Research in London. It is capable of accurate and repeatable acuity measurements in either set in the elderly population, and is an efficient tool for the school screening also. Then comes the Ophthalmology Guide. It is a well-organized and topic-oriented e-book application. So there are systematic details of every topic and subspecialty, including latest ophthalmic instruments. So there is a clear categorization, makes very convenient for ophthalmologists, and it finds the specific guidelines accurately and quickly during our busy time in the clinic. Then comes the iTube application. It is a global ophthalmic video pool. It collects professional videos specifically related to ophthalmology, and aim of providing the ophthalmological education and surgical videos with free access. And it is a time savvy indeed. Then comes the Community Eye Care application. It is a free online and offline access to the peer reviewed articles. It aims to improve standardization and enable easy access to eye care knowledge for all categories. Then there is this iHand book application, which is used for diagnostic and treatment reference. So it is a one-stop shop for multiple needs of ophthalmic practice, and it offers a dozen features for both ophthalmologists and eye care workers. Then there is this Smart Optometry eye test for the professional application. So there are various vision screening tests, including color vision, near vision, test for amblyopia, worth for dot test, Hirschberg, and Amsler grid. It is available in 11 languages in both Android and iPhone. It is faster, easier, and results are very accurate, reliable, and clinically validated. Then the MVT, it converts the Apple smartphones into a medical device. It tracks the progression of vision damaging disease such as ARMD and diabetic retinopathy, and patient test data are automatically uploaded to a physician's portal for monitoring. Then comes the toric IOL axis marker developed by Dr. Girish Jetwa and Dr. Mukesh Dholakia. So it helps in calculating the angle needed as we need to implant the toric IOL. Again, iToric Patwardhan developed by Dr. Saurabh D. Patwardhan. It also helps in getting the accurate alignment of the toric intraocular lens. Then when the North Indian, the residents or the ophthalmologists, they are going for their DNB or different courses in South India, so they are unable to understand the language spoken by the patient. So there is this wonderful application, I Know Tamil, I Know Bangla, developed by Dr. John Davis Akara and Dr. Anju Kuriakose. So it converts whatever the patient is saying into Hindi or English or in any language. And it is absolutely free. Then for the blind people, visually impaired people, so this smartphone application, it reads any paper and it converts into the English or Hindi for the blind patients. And this is also application is free. Then comes the Vikas. This is a visual intervention kit with analytics for the spatial children, like the patients with cognitive visual function and the autism and the patients of cerebral palsy. So this Vikas helps in improving their quality of life by doing the visual exercise, and it is also available free of cost. Then Oglecam for the medical records is developed by Dr. Sunil J. Meravade. So requirement of installation is smartphone with Android operating system 5.0 and up, and it is a one-shop platform for the teleophthalmology consultation, and it also helps in the referral smartly. So in the future and conclusion, concerning the professional educational apps such as the iHandbook and iEmergency Manual app, institutions or individual could endorse and make suggestions. Applications dedicated to professional use must also be peer reviewed. That is missing in most of the applications. Only 4% of these applications are validated. So these need to be peer reviewed and validated. Studies are needed to understand the readiness and concerns of eye care professionals in adopting the mobile health. Guidelines to choose an appropriate applications are suggested. An importance of interdisciplinary collaboration in the design, development, and validation of applications must be there. Thank you so very much.
Thank you, Arvind. Any questions? Or we have 10 minutes more. Any suggestions or comments? Anybody using AI in the audience?
How are you using that in what form? Yeah.
Mike, please.
My name's Adam Wax. I'm a researcher from Duke University in the United States, biomedical
Mike is not on.
Sound, please.
Hello?
Yeah, we can hear.
Hi. My name's Adam Wax. I'm a researcher at Duke University, Department of Biomedical Engineering. We use AI in a number of applications, including denoising of OCT images, which I found interesting in the previous talk, but also to identify things like Alzheimer's disease and OCT scans. I want to echo the sentiments that I've heard from all of the esteemed colleagues here that AI has a good role in helping physicians identify disease, but that there is the danger that if we rely too heavily on AI, it will not do as we expect, because it will not be able to accurately identify the abnormalities that we see instead think that they're just imaging errors. So we will always need the human in the loop to be able to identify those. Thank you.
Talking about the imaging errors, I think you're talking about those, right? So we need to train the system to identify those errors and pre-process the images before it is fed into the system. That will basically involve training of the machine. Yeah.
It's a very pertinent question asked by you. So there are a lot of digital data in the field of ophthalmology. So many of these images they are not gradable. So how to make them gradable? So there are a lot of applications which are AI based. So number one is they reduce the size of the pixel of the image, but keeping the high resolution image intact. Number two, so they can make the images gradable by adjusting the contrast, the brightness, and red-free image. So most of the images they can be graded by the ophthalmologist. So there are a lot of applications AI based. But not every image can be graded. Of course not.
Anything the audience would like us to discuss? Any queries? So Arvind, what do you see in future? How our work will be affected by AI? How our practice will be determined by AI?
I think when the computer came, so we were very much apprehensive. So finally, everyone is using the computers, the smartphones. The first supercomputer was at NASA was 10 room, was kept in a 10 room facility. But now the present smartphone, the Apple iPhone, is processing everything, all the digital data 100 times faster than that supercomputer. So we need to understand that AI will remain there in the life of the ophthalmologist as well as everyone. So we need to accept it as a part in helping the treatment of the patient in diagnosis and especially in the era of the COVID. So there we can't touch the patient cannot come to us. So these applications helped a lot in giving tele-ophthalmology consultation and giving them the best treatment, especially in the follow-up sort of thing.
Follow-up and progression of the
Yeah,
diseases. Yeah.
definitely.
So where the humans can miss a lot of things, the AI will be able to identify and tell us, going to assist us.
Humans are there to err. We may get tired sometimes, so we might miss the fundus finding in the periphery. But these applications, they will be honest all the time.
And what's your take on the concern shown by very lot of people regarding AI? Recently, I think Elon Musk and guys have shown concern that AI is going to not cause, but it may be very detrimental to the humanity. Do you agree to those concerns?
Partly because AI cannot replace the human touch. Our emotions, the way we are talking to the patient with that empathetic attitude. So AI definitely lacks that. Definitely it lacks.
Yeah. Anything else we want to discuss, or we call this session off?
Natarajan sir, concluding remark.
Okay, I think as I said, the concluding remark, the AI will have to, we have to use them, whether we like it or not. Anything like there are side effects for like the alcohol and drugs available, and when you go to US, you have the gun problem, and you have to face it. So I think there will be good and bad, as Stephen Hawking said. It can either destroy or can create. But I think we as ophthalmologists, whatever Elon Musk and other people are telling, I mean, there are a lot of things happening in the world, but I think we can, for ophthalmology, learn to make that as our like a
Used to our
assistant
best.
to use it, so that a lot of regular work where in a routine or a repeated tasks by an eye doctor can be replaced with AI, so that you don't miss a finding. And as Dr. Arun Shetar was asking about laser, it can say that you are now focusing at phobia, so for the beginner it will be good. But I think AI will definitely be an excellent tool to assist us, and it's going to be lot of things are going to happen during this time. So I think thanks for the session, and thanks to Partha here for asking to have a AI in ophthalmology. And I think there is a lot of funding for AI research in ophthalmology, and there are several sessions in RO this year conducted by the National Eye Institute and Dr. Tin Wong from Singapore and Dr. Daniel Ting. They are working a lot of things on AI. So even in research.
So, because the concern is, sir, that not all the applications are validated. Only 2 to
That's
4% of these AI applications are validated. So, what is your take on this important issue?
So one is in my practice, I'm still doing both manual and AI, and so far the referral diabetic retinopathy, which is what we are important, where we are concentrating, where treatment required patients should not be missed. But the other things there are mislabeling happening, which we are okay with it. So I think we have to be careful, as you correctly said. Any technology, we have to be careful.
So,
When
it
you're-
needs to be supervised, or not
Definitely.
semi-supervised?
Yes, definitely you
Yeah.
have to supervise.
until
Thank
it
you, sir.
becomes perfect.
Yes.
Sorry?
Until it becomes perfect.
Yeah, definitely.
Yeah.
So, we conclude this session, and I would like to invite all the speakers for a group photo.
Thank you very much.
Okay.